Thank you, Mr. Chairman and Ranking Member Brady. I really appreciate the opportunity to be here today. I thank you for hosting this hearing today on America's mental health crisis. Right now, our country is also facing an inflation crisis, a border crisis, an energy crisis, and multiple national security crises. Many of these issues are within our jurisdiction. It's time this committee met to address the crises that are affecting all Americans every single day. We now have the data to prove that shutdowns, lockdowns, and social isolation have drastic long-term effects on mental health. My previous friend there, colleague right there just spoke about it, Democrat from California, and Mr. Panetta. I really appreciate him acknowledging that. The Biden administration's ever-changing COVID strategy only adds to the stress and uncertainty that all Americans are already feeling. Biden signed a mask mandate executive order during his first week in office, then lifted the mask mandates 3 months later, then reinstated them 4 months after that, and another 4 months later, he issued a vaccination mandate on top of it all. Vaccine mandates put further stressors on individuals who are forced to make a choice between their personal health and their paycheck. We are more than 2 years into this. It's long time past to provide Americans with certainty and stability and stop promoting isolation, which we know exacerbates the mental health crisis facing our country. Let's look at the facts. A study from the university psychologist confirmed what many of us have said all along. Lockdowns and school closures not only increase depression, loneliness, anxiety among children, but they also isolate vulnerable students from needed interactions with teachers, faith leaders, and community members who are trained to notice when a child or adult is exhibiting signs of mental health issues. Since schools closed and children were forced into isolation from their peers, we've seen a 30% increase in teen mental health related emergency department visits, and the highest number of overdoses ever recorded in a 12-month period. The numbers don't lie. We know what's working, and we know what's not. It's clear that mental health is a growing issue, and I want to talk today about the technology that has opened a new frontier into mental health support. In 2018, Congress passed the SUPPORT Act, paving the way for seniors to access virtual health consults for mental health issues. Telehealth, or as I call it, virtual health, has become even more popular during COVID-19 pandemic, with more than 52 million seniors utilizing telehealth, a 63% increase, because of current regulatory flexibilities available under the pandemic. Unfortunately, this committee has done no work to keep those virtual healths an option for seniors post-public health emergency. It's time for us to begin the tough work to make virtual health flexibilities permanent. Our employers have made the virtual workspace a permanent fixture. We should be doing the same with our medical care. We need to figure out how much to pay health providers for virtual visits and come up with a plan to pay for these benefits without bankrupting the already financially unstable Medicare Trust Fund. Ms. Avila, thank you for your testimony. And in my remarks, I highlighted the success of technology and virtual health during the pandemic. As other industries like banking, clothing, and food excel in the digital space, consumers are increasingly expecting a digital healthcare experience to match the rest of their lives. So my question to you is, in addition to the virtual visits with healthcare providers, is there any other technology Congress should look at as a resource for mental health, like therapies on phone applications? And then a second part of that question would be is, what role should these apps play in digital therapeutics today?
Yeah, thank you for the question. I think it was mentioned earlier about an app that was developed by teenagers. I think absolutely the use of apps and technology-based care can really be of great assistance, particularly to reach young people. Absolutely, I think that should be looked at. SAMHSA also recently put out a psychiatric advance directive, which is available via app. So that, again, is a means of connecting with the healthcare system in a different way, but being able to have individuals with serious mental illness identify what their needs would be if they were in a mental health crisis. I think utilizing technology of any kind to advance care, utilizing technology to develop virtual support groups, virtual peer groups, again, this will be a real way to engage our youth. It is also a very, very good way to help train and educate providers. Technology has been used quite a bit in that realm, and I would like to see that continue as well.
Ms. Avila, I appreciate your expert testimony, and thank you, Mr. Chairman. I yield back.